Hi, I'm Elizabeth. I'm one of our pediatric staff nurses here. In this video, we're going to discuss the treatment and typical recovery course for children experiencing a mild traumatic brain injury, or a TBI. Understanding this process can help ease concerns for both you and your child and know what to expect. In video 1, Brain Injury Basics, we reviewed common symptoms of a mild TBI. It is important to remember that these symptoms are all common after someone has a brain injury. The doctor should help you make a plan for how to manage symptoms. In some cases, symptoms can be managed by avoiding certain things that trigger them. Medications may be given to help with pain, headaches, nausea, or vomiting. The best option to help with headaches is Tylenol or acetaminophen. Be sure to use the right dose for your child. If your child is vomiting, the doctor can prescribe medication to help with the symptom as well. Rest can also be very effective to help relieve discomfort and reduce symptoms. At this point, your child has been seen by a doctor in our emergency department and diagnosed with or suspected to have a TBI. The emergency room provider will determine when your child is safe to go home. Depending on the situation, your child may have to be admitted to the hospital for further monitoring and support. If this is the case, the medical team will watch your child closely for brain injury-related problems. Before your child leaves the hospital, they will talk to different experts to help diagnose the effects of brain injury and make recommendations for treatment. This includes occupational therapy, who works with visual perception and coordination, physical therapy, who assesses things like movement, muscle strength, and balance, and speech-language pathology to assess language comprehension and cognitive skills. If your child is hospitalized, they will likely be visited by at least one of the therapy providers. Your nurse will review a checklist with you and tell you which of the therapies will evaluate your child. If your child is discharged in the emergency department, they may be referred to one of these providers as an outpatient, but may not need these if the symptoms are manageable. Recovery can look different for each child. In the first week after injury, it's normal for your child to experience headaches, dizziness, sleepiness, moodiness, or confusion. These symptoms are a part of the healing process. Most children with mild brain injuries begin to feel back to normal within a week to 3 months. It is important to be patient and provide support during this time. Be sure to check out the video about TBI follow-up, which gives guidance on brain injury follow-up and how to intervene for those who are not recovering in the typical time frame. Next, we will cover how to help your child recover from a mild traumatic brain injury, or TBI. With the right strategies and support, your child can navigate this healing process effectively and get back to feeling good and doing what they love. First and foremost, getting plenty of rest is important during the first few days after a TBI. Make sure your child gets enough sleep each night and takes regular breaks throughout the day. Do not isolate your child or make them lie in bed all day. Naps can be helpful if extra rest is needed, even in older children. Just make sure that the sleep during the day is not disrupting sleep at night. You can let your child sleep uninterrupted so their brain can heal. Next, it is important to gradually return to normal daily activities. This means working to find the right balance between doing too much and doing too little. Start with gentle activities such as walking, reading, listening to music, or even light schoolwork. For the first 1 or 2 days, keep these sessions limited to just 10 to 15 minutes at a time, then gradually increasing the duration as they feel better. Some mild symptoms are normal during this process. If your child experiences severe symptoms or they get worse with activity, it is important to stop and try again later. Being active can help your child recover quicker. Another key point is to limit screen time for the first 1 to 2 days. After that, you can start introducing short periods on screens, especially if schoolwork requires it. Begin with just 10 to 15 minutes, gradually increasing as tolerated, and stop if symptoms get worse. It's also important to avoid mentally and physically demanding activities. This includes overstimulating settings such as parties, sports events, as well as high-intensity exercises like running, sports games and practices, and heavy lifting. Keeping the environment calm can significantly aid in recovery. Lastly, it's crucial to avoid drugs and alcohol during recovery. These substances can interfere with the healing process and exacerbate symptoms. By promoting a gentle and supportive environment, you're helping your child heal effectively. Encourage them. Stay patient. And remember that each child's journey is unique. When a child is fully recovered, they can do their regular activities without any symptoms. If your child feels sad or frustrated during their recovery, acknowledge their symptoms and remind them that even though this is difficult, they'll likely feel better soon. Share information about the concussion or mild TBI with family, school, caregivers, and others who interact with your child so they can help. Being there for your child during this time can make a world of difference. Celebrate their small victories and be mindful of their needs. By promoting a gentle and supportive environment, you're helping your child heal effectively. Encourage them, stay patient, and remember that each child's journey is unique and every child heals at their own pace. Thank you for joining us today. By understanding treatment options in the recovery process, you're better equipped to help your child navigate their healing journey. Stay tuned for more informative videos and take care.